Hey, Punkoutlaw, it's Buddha Gem, and I just wanted to throw some things out there on this health care thing. I don't know what it is, but for some reason when we Americans start talking about health care, it's us and Canada, and pretty much nobody else is mentioned. I don't know why that is, but, according to the World Health Organization, Canada only ranked 30th. We ranked 37th. Not a huge difference. If I'm going to have this discussion, I want to look to who is doing it the best. And according to the World Health Organization, that would be France, Italy, Spain's up there, Austria, Japan, Norway. And that's who I would be looking to, not the person who's barely, getting by me. And see what we can learn from that. What troubled me about your video, though, was, I tried to make it in the comments, is that you claim that this universal health care would cost us more. I simply don't see any evidence for that. I mean, if we look around the world at the industrialized nations who, by and large, have universal health care, that's simply not the case. The United States spends more than any nation on earth per capita on health care. $4,271 per person, according to Nation Master. You go look at France, who again ranked number 1 in health, $2,288 per person. It's a huge difference. That $2,288, they're able to cover everybody, and according to the World Health Organization, provide a pretty good health system, the best in the world. That's amazing. If I told, wouldn't that be a no-brainer? If, I were to say to you, Punkoutlaw, I could reduce what we're spending, cut it almost in half, and cover everybody in the country. It's a no-brainer, right? It shouldn't be controversial. You can have your qualms about the state, and it's not a long-term solution, and I'm with you on that. But, sometimes we have to think in the short term, because, if you get sick tomorrow, you need that coverage. Luckily you have it. But a lot of Americans, 45 million Americans, last time I looked, have no coverage at all. That's scary. And another 40 to 50 million, maybe 80 million, depending on, where you look, have such shitty coverage, such high deductibles, such piss poor coverage, but they can't really effectively use the coverage they have. And I'll remind you that Americans, the number one reason Americans are filing bankruptcy is because of medical bills. So clearly the system is not working. We're ranked 37th in the world. It's a no-brainer. We're ranked 37th and yet spending more than everybody else. That's like you spending more than everybody you work with on a car and you drive into work in a 82 Pinto. People will be wondering, well, how are you so dumb? How would you come into work in a Pinto? You spent $100,000 on that Pinto. We're spending way too much and getting way too little. And it's waste. And the waste is in the private sector. I'll challenge you to compare any private insurance company that exists in the United States of America to Medicare. The executive costs, the management costs, Medicare would destroy them all. There's no private insurance company in this country that's going to come close to the costs, effectiveness of a system like Medicare. It's simply not. You look at the private sector industry, the average is in the 30 to almost 40% range. 40%. For nothing, for these paper pushers. For your doctor to have to fill out all this paperwork and send it off to some bean counter, and, it's complete waste. It doesn't need to be there, So, my point simply is going to a universal health care system is not free, but it could be a hell of a lot cheaper, Even if we, just look at, we can do it. Why can't we do that? We can look to France, Japan, Luxembourg, Denmark, and say, what are they doing? Let's do that. And we don't have to look to Canada. Canada has problems. Canada's doing a little better than us. They spend a hell of a lot less than us. And, just some food for thought. And I know all the qualms about the state intervention, blah, blah, blah. But at the end of the day, I think we do want good health care for us and the people we love. And we're certainly not getting that in this country. Our healthcare system is a shamble. It's incredibly dysfunctional. We're not getting the care we need. The employees, we're having to import doctors from third world countries because we simply don't train them in this country. We're not investing in that infrastructure that is needed. But again, I just want to emphasize that there's simply no reason to think that a universal healthcare system should, would, or has to be more expensive. Simply not the case. And if you can find a nation that has universal health care that is spending more per person than we are, while we, lack coverage on a third of the population, I'd be interested to see it. But by and large, these countries that have universal health care are spending considerably less than we are and covering everybody, and usually with a much better system than we have. So, something to think about. I look forward to hearing from you, bro.